Hello, today we are going to present about two criteria in psychiatry that is very important in psychiatry. So that is Hunter serotonin toxicity criteria for serotonin syndrome and Levinson's criteria for neuroleptic malignant syndrome. Hunter serotonin toxicity criteria. What's the prerequisite? Patient should take serotonergic agent, that is compulsory. And clonus. Clonus should be in the form of spontaneous, inducible or ocular clonus. What is clonus? It's a rhythmic, involuntary, repetitive contraction and relaxation of the muscle. It could be a spontaneous one or inducible one. When you examine, if there is a clonus, then it can also be labeled as serotonin syndrome, one of the criteria. And rhythmic ocular clonus is rhythmic, spontaneous, side-to-side eye movements with hypertonia and temperature of should be more than 38 degrees centigrade. So this is the important criteria. So there should be history of serotonergic agent with any one of the following should be present. This is Hunter's toxicity. Then Levinson's criteria for neuroleptic malignant syndrome. This is a closed differential of serotonin syndrome. All three major criteria plus two major, four minor criteria. Fever, muscle rigidity, that is lead pipe rigidity, elevated creatine kinase levels. Minor criteria, tachycardia, abnormal blood pressure, hyper or hypo, tachypnea, altered consciousness, diaphoresis and leukocytosis. There should be history of dopaminergic antagonist exposure. So antipsychotics should be, patient should be exposed to antipsychotics. Then, so differentiating points, serotonin syndrome, neuroleptic malignant syndrome. Trigger should be history of serotonergic agent exposure. Here, history of antipsychotic. Onset is one more differentiating point. Serotonin syndrome will be usually rapid onset, but NMS takes longer time to act. Like it will be around slower onset, like 1 to 3 days. Hallmark neuromuscular. This is very important. So hallmark neuromuscular sign include here it is clonus and hyperreflexia. Here it is lead pipe rigidity. Lab findings, usually elevated CPK levels. That will be the CPK levels will be 4 times the normal. The normal CPK levels are around 200 to 250, but in NMS you will see CPK levels more than 1000. So it is usually said that it will be increased 4 times the baseline levels. And here elevated CPK levels, if it is severe only, we will be seen in serotonin syndrome. Diagnostic criteria, again it is Hunter's toxicity criteria and here it is Levinson's criteria. Treatment, usually we give with benzodiazepines and the asymptomatic management with serotonergic antagonists like cyproheptadine. Here the same. First you have to stop the offending agent in both the syndrome, the serotonergic syndrome and NMS. We have to stop the offending agent. Then you can treat with benzodiazepines. And here in serotonin syndrome, usually we give 5-HT2A receptor antagonist like cyproheptadine, that is serotonin